Hello, my name is Rose Stegman, and I'm the owner of Chiquila Creek Health Insurance, and I'm here to give you a little bit of information about the AR Health Network that's available to all Arkansas residents. The AR Health Network program, to start with, covers 7 days in the hospital, 6 office visits a year, and 2 outpatient services. The 2 prescriptions a month, you have a small copay on those. There's $5 for generic. You can get a lot of your generics at local pharmacies for $4, but there's some other generics that are higher priced, blood pressure, things of that nature. You can also get the non-formulated and brand non-formulated medications, and those would be disclosed by your pharmacist. Those are either $15 or $30. Your deductible is $100. That only applies if you go to the emergency room or get admitted into the hospital. You have a 15% copay for a doctor's visit. So if your doctor charges $100, then you would pay the $15. You have a $100,000 maximum per year. The best part about this program is there's no underwriting, and what that means for people is with no underwriting, all your pre-existing conditions are covered. So if you've been turned down from other companies because of pre-existing conditions, that wouldn't be a problem with this program. This program also does not delete any other government programs that are available. If you were on this program and become pregnant, you could still get on the Medicaid Family Planning Program, and it wouldn't interfere at all with this program or that one. So they work really well together. The cost of the program is if you're a self-employed person, and that would be with a Schedule C as far as your tax return goes. Farmers would have a Schedule F. That cost would be $35 a month. If you're employed at a local business in the state of Arkansas, then it would be a payroll deduction, and it would be $25 a month. For somebody to obtain this insurance, a self-employed person can contact me directly, or go to the website of arhealthnetworks.com and look up an agent that's closest to you. If you're with a group, and that could be an employer from anywhere from 2 people up to 500 people, that employee could actually contact us, and we could send them information, and they could present that information to their employer. It's very important that this program does go through a business, so it would have to, your employer would have to improve the program. With it being such a low premium program, there are qualifications. You have to be an Arkansas resident. We would ask that you prove that by giving us a copy of your driver's license or your state ID. You have to be a U.S. citizen, which you would provide us with a copy of your birth certificate. A lot of people have naturalization certificates. That's where they've held their green card for 5 years and taken the naturalization test, or been a part of, family, a part of the military, and was born out of country and got their naturalization certificate, and that's perfectly fine. If someone has carried a green card for 5 years or longer, then they would qualify for the naturalization test, and they could also qualify for the program. With it being income-based, a single person can make $10.49 an hour and still qualify for this program, working a 40-hour week. Another good way to find out if you qualify income-wise is if you have children, and your children are on the RKids program, whether it's RKids A or B. This income guideline is actually the same exact as the income guideline of RKids B. So if your children are on that, there's a large possibility that you would definitely qualify for the program. I'm very excited to offer this insurance and spread this news, because it's something that we've all needed, and many of the employees that you have will be desiring it. The great part about this is even once they obtain the insurance at a low price, everything is kept so low, the deductibles and everything else, that as an employer, you'll actually be able to sleep at night. I know I can. I get a lot of phone calls from people thanking me for letting them have this insurance and getting their company this insurance, because whenever they go through a traumatic incident, the fact that they're not going to come home from the hospital and have outstanding hospital bills is quite amazing to so many people.